Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
The topic today in Neighborhood Health Watch is peripheral vascular disease and new treatment options. It's a blood circulation disorder that causes blood vessels outside of your heart and brain to narrow, block, or spasm. Now, this can happen in your arteries or veins. PVD usually causes pain and fatigue, most often in your legs, and especially when you exercise. Dr. Robert Levitt with Henrico Doctors Hospital is here to get us informed. Thank you so much for joining us. Let's start out first with the causes. What causes this condition?
Well, peripheral vascular disease, or more specifically peripheral arterial disease, has several important risk factors: diabetes, smoking, hypertension, and cholesterol. Diabetes and smoking seem to be the biggest risk factors for diseases in the arteries of the leg, where peripheral vascular disease most commonly occurs.
You know, I mentioned some of the symptoms earlier, but are there symptoms that mimic other conditions? And I'm just wondering how difficult this condition is to diagnose.
Well, it's not difficult to diagnose if you look for it, because there's some really easy tests to diagnose it and measure on pressures in the arteries of the leg, or for the doctor just to feel pulses. But leg pain can be a lot of different causes, but when it's leg pain with walking, especially in the muscles and calves of the leg, that's pretty diagnostic of peripheral vascular disease.
And how do you treat it? What are some of the options?
Well, there's really three basic types of treatment. There's a conservative treatment when it's not so bad with medications and a good walking program, and it's slowly progressive, but it helps a lot of people. There's also the older treatment of surgical treatment, bypass surgery, using a piece of vein or a Dacron graft to bypass it. It's an operation, there's a lot of recovery, and more recently there's been a lot of advances in what we call percutaneous intervention, which is fixing the arteries with tubes or catheters from within the artery.
And you have a catheter here.
Yeah,
how would that be
This
used?
is one of the catheters that's used. It's introduced into the blood vessel through a needle hole. Through that, we have a lot of different tools, which we call devices, that can cross these blockages, that can clean out the blockage in the artery, lasers that can vaporize it. And then to open up the artery and keep it open, we have balloons and stents now with chemicals on them can open them and keep them open with a chemical.
Is the prognosis usually a good prognosis?
If you can catch it early and treat it well and modify the risk factors, people can do well. If you let it progress to the point where somebody would have an ulcer infection on the foot and it's not treated well, it can lead to amputation.
All right. Dr. Levitt, thank you so much for joining us. We appreciate it.